Welcome to СիվиլНեթ. My guests are Darbidian and Ghulyan. One is an Armenian from the US, the other from Armenia. They both work in the field of engineering and high technology. They are collaborating to boost healthcare innovation and specifically digital healthcare in Armenia. Thank you for joining us.
Thank you for the opportunity.
Thank you.
So, first question, which is a deep question. What gaps is Armenia facing when it comes to healthcare and high technology? How can Armenia be more competitive and innovative in that sphere?
Yeah, so that's precisely was one of the key questions we were asking when we started this effort. And fortunately, Arthur's team had started engagement much earlier than I joined. It's a really tough question. And typically, innovators, what they do, they identify just one key area and they just dive in, they start development or they go after certain ideas. We decided our approach is going to be kind of different, holistic, and more of a platform-based, and we're going to approach this a little bit differently. So based on that, we decided that the Healthcare Innovation Center is a good way to create a platform to get a very good understanding of what the user needs are and what the ecosystem is. That understanding that ecosystem is really important. That involves patients, doctors, care centers, hospitals, etc. So really, we really understood that it's key to develop a very good view of the whole thing, and then create a good platform, and from there create ideas and initiatives. So based on that, we came to the conclusion that we needed some way of a social network or social means of kind of channeled and very specific network where most professionals could come in and contribute and collaborate, because that is where the ideas will come together, and then you'll understand where the opportunities are. So that was one of the pillars of our understanding. Secondly, we recognized that we needed partnerships also with education and centers of excellence. So I'm sure Arthur will talk about that later, but that was also a key pillar of what we needed to do. So all of that has led us into really developing a much better picture. That picture is continually getting developed, and then, as I said, it's created innovations and it's created opportunities. One of the opportunities is the high care initiative that's it is there to serve, to drastically improve the outcome for everybody involved in this ecosystem. It's a patient care management system. So, and it addresses some of the key things, which is availability of the doctors and monitoring and of the patients and understanding their needs and really realizing what are some of the key things that we need to serve. So as we're going along, we're developing really a lot more initiatives that are going to lead into some key actions and development of some solutions coming forward.
So this is about the Healthcare Innovation Center and your project, but I mean in terms of healthcare in general in Armenia, if you compare with other countries, you come from the US, I guess the innovation and technology is very much different and it's at another stage. And in Armenia, we still have a lot to go. So according to you, Arthur, what's missing here in Armenia precisely in terms of healthcare?
I think maybe I will share my understandings. I think main gap which we have, so lack of understanding of ecosystem, healthcare ecosystem in the world. So when you are doing some kind of healthcare innovation, many factors affect your innovation. Like you have many players in the field, insurance companies, government, healthcare institutions, healthcare professionals, patients. So you need to consider all their needs in order to build, healthcare innovation and make some effect in this field. Another, I mean, important example, government policies. They are very strict overall. I mean, in each country, they have their own regulations, and you need to consider in order to enter into this market. I mean, it might be US, it might be European market, Russian market, or Eurasian market. They are totally different, and you need to know in order to build your innovation accordingly. And I think many other things. I think now more and more patients are becoming more and more demanding. And patient-centric, I mean, healthcare is becoming more patient-centric. So you need to consider all these, I mean, factors in order to be successful in your healthcare innovation. And therefore, you know that we have many different healthcare innovation centers in Armenia, but we don't have special one in healthcare. I mentioned several factors which affect these innovations. Therefore, we decided to establish such kind of center here, which will facilitate healthcare innovations, digital healthcare, I mean, improvements in Armenia and outside of Armenia. Important thing is that we can bring such kind of innovations in Armenia very fast, quickly, and after that scale it, I mean, in other countries. That is very important. I mean, what is a center, maybe what our center is doing in this direction. First of all, we have different, I mean, maybe directions or goals, or so one of them, it is bring awareness. So first of all, we need to bring awareness to Armenia, because digital healthcare market is huge. It's about more than $1.5 trillion market. But Armenian startups, I mean, people, they are not so active in this field. So we need to bring awareness, share, I mean, all these opportunities to our to Armenian citizens, so they will be able to grow in this market. Another important things, people who know, I mean, who has some ideas like, I mean, research, innovations, etc., they are not able to somehow build their product from business perspective, because their understanding is good, they have many good ideas, etc., but they are not able to bring it to the market. So here, I mean, Healthcare Innovation Center will support them from business perspective, from networking perspective, from education perspective. And next one, it is scaling. So when you are doing something in Armenia, because it's very beneficial, because Armenia is very small, we have many gaps in our healthcare system, and we can cover them. I think you know that it's easy just to somehow pilot here, etc. We can support there, and after that scale it in different countries. That's, I think, main directions which we are working on.
Yeah, the one point I wanted to emphasize is that this is an open system, so it's not exclusive to us. We are developing ideas and innovations and initiatives from within. We have a very active team, and we have funding mechanisms to really develop those and drive them. But the key point is that it is open, and it can accept others who are interested in this, you know, in the approach. The digital health kind of ecosystem is huge. There's so many pieces to it, and there's no way one player could dominate one or get engaged totally in one or the other, right? So there is a need for specialties and concentration. And then what we're looking for is really good players, competent players who are really good in their field to come in and kind of complete the picture. And we're there to create the bridge, to create all the connections that we have developed, the processes, connections, all of that is available to anybody who wants to join and participate and become part of the team.
So your platform, as you said, is connecting doctors from Armenia and also from the diaspora. And in general, so we got it that it's a way to harmonize and facilitate the experience or their skills. But what do you have so far as a result? What do you foresee in the future with them?
Actually, I think maybe I will share, I think, few already, I think, achievements which we have. One of them we have already built recently, and it's already, I mean, available in the market, I mean, in Apple Store, in Play Store. So we have solution which is Net Profession N. It is professional network for healthcare professionals, I mean. And it allows just them to somehow, it's like LinkedIn, but for healthcare professionals, very dedicated, so they can share all the news, innovations, etc., discuss it. Especially we realized such kind of need during the COVID, when we were not able to somehow understand what is right, what is wrong. And here, if you have this community and trusted community, so you can find appropriate information and somehow trust to these, sources. Another, also very good experience which we had a project with TUMO. It's about digital healthcare. And here it was also one new initiative for us, because what we did, we didn't focus on some kind of programming language, etc. We brought some kind of combination of industry experience. We brought some doctors who start talking with software, engineers or some interns. So because they need, first of all, they need to understand each other. Important things that when you are giving you are training people, you need to somehow combine two skills: domain expertise and technology. But in order to understand that, you need to be able to communicate properly with these domain experts. And who are our main domain experts? These doctors. Doctors and engineers should talk in order to understand their needs, because they are talking in different languages. But it was, great experience. We saw that our, students were able to discuss, understand the problem tasks, and they were able even to implement certain things. That was, great experience. We need to teach people to solve problems from industry, not just technical problems which are coming from there, but just problems from industry, which is coming from industry experts and domain experts.
Yeah, in the US, when we embark on developing of a product or a project, what that actually is called is user needs. Actually, the end user, how they're going to use it, what their kind of knowledge base is, and how can you be effective. So that, what Arthur described, is a key factor in you being successful in doing something that's really, at the end of the day, is going to make improvement. And what are we looking for? We're looking for better care for patients. It's outcomes. We're looking for much better outcomes, drastic change in outcomes. So that way, patients are going to feel much better. They will feel that they're taken care of. Professionals are going to kind of have this much better setting where they could understand exact needs of the patients. They could follow them up. So that kind of scales across the board and in industry. So that it's critical to really understand how each one of these kind of segments and users have their needs. And typically, folks dive into development without really understanding what the user needs are. And then when you develop a product, then it's not going to be successful, because it's not addressing all the needs that there is. And then it's not going to be really changing and bringing about the changes that are really needed.
And just one additional point. So now I think healthcare itself, we are moving from disease treatment to well-being and quality of life. So it's very important, because patient now is driving all this stuff. So you need to understand all these aspects in order to build something, really very efficient for, patients and for practitioners. Yeah. Definitely here we need to have combination, because practitioners or doctors should also accept it, and also patients. This is two sides, and it's a very complex problem.
Yeah, in the world, the model has changed. The treatment model has changed. Before it was number of visits and then, all of that. But now it's more and more, it's about outcomes. So really everybody is looking for the proper outcome for the patient. And if it's not achieved, then there are issues with many aspects of that system that is trying to handle that. So it's the dynamics are changing, the model is changing. Also, because of COVID, the way the interactions have changed. And there is more acceptability of these technologies. Now people have seen it, have tried this kind of telehealth type of things, and they're more accepting. And they're willing to now engage in this technology and kind of willing to experiment at least, or start using the technology, which is great and gives us a lot of opportunity.
Mm-hmm. So you are also geographically far away from each other. You're from the US, you're from Armenia. What can you tell us about your collaboration experience with each other? How did it go?
Yeah, so I'll start. Really what brought us together was our passion and vision for in this area, really. We started our collaboration towards the end of 2019, right before COVID hit. I've always, traveled to Armenia for, your summer type of things and all that, and I had kept my kind of interest with technology. But then once we met and kind of talked about it extensively, really it was clear that our passion and vision is going in the same direction. So our collaboration, when we started, there was no conditions, nothing. It was just two colleagues who have the same vision, and it just got, let's start collaborating and let's see where we're going. Let's create a great understanding of what's going on. And then we just maintained that through kind of the COVID, through Zoom meetings and all of that. And this year I just couldn't wait to come here because I knew that we could kind of take it to the next level. So, and that's happened really. So really great collaboration and understanding and work. And also it's not just Arthur. He has a great team that I continually work with. Also, as I said, I'm playing that bridge role between expertise that we may need or other experts who are interested in US, and I think we've kind of also tapped into a lot of those possibilities, which is great.
Do you want to add something?
I think nothing to add because it's now technological, era, and it's very easy just to communicate through Zoom, different other, means. It's very easy. So just you need to have, common vision and, passion, and that's it.
Some people might say that people in the diaspora they have another vision of things or a cultural difference with Armenians from Armenia, and collaborating is pretty complicated. And even some people come to Armenia, and when they start something, Armenians from the diaspora, when they start something, a startup or anything, they start to do that by themselves or collaborating with someone who's also from the diaspora. And then they hire people in Armenia, locals, but there are few collaborations at the same stage, at the same level between an Armenian from the diaspora and another from Armenia. But you're an example that you both are at the same stage, at the same level, and you're co-workers, and you're working towards the same path and the same goal. So would you say that in the end it's possible for Armenians from the diaspora and from Armenia to have a common goal and work together in harmony? That's achievable for you? Yeah,
I would say 100%. Don't set any, my experience has been, don't set any preconditions, because quite often folks want to engage and right off bat they start setting barriers and conditions, and it becomes an impossible task. So don't set any preconditions, just engage and start. As long as you find somebody who's sharing the same vision and same passion. The field of high tech has its own way of uniting you, because you're speaking the same language, and you, after a while, you see where the opportunities are, where the gaps are. So that on itself kind of is a uniting factor. The other thing is, obviously, you have to have that chemistry or that personality that is able to do that. And I think we do have that, and we've established it. And during this course of our engagement, we've established, so the next thing is the trust, right? So we've established that trust. So there's really, without any hesitation, I could, very openly and transparently collaborate, which is great, Again, just coming back to it, my experience tells me, engage, find the right thing, engage. Don't go alone, because you're coming into a system where there's a lot of things you don't know. And a lot of the disappointment comes from the fact that you don't know those things and you're trying to figure this out. You don't need to do that. As long as you find the right group or right person, all of that gets solved. The other thing that I see quite often happening is somebody wants to kind of get these connections in the government or do things, and before they will engage. I would say don't waste your time on that too much. It's good to have those connections and all things, but if you have an idea, you find a good partner and it's a viable idea, just go dive in, start working on it, and things are going to develop. And if there's value there, if there's something that's going to have a great return, other people are going to recognize that, and they're going to come and join you basically, and they'll promote the whole thing. So just unconditional, commitment, and then a lot of hard work, because those Zoom calls are like early 7 a.m. here, 9 or starting at 9. But if you have the passion, then you're going to put the hours in it. And we're both very dedicated and busy professionals and executives, right? In the sphere of areas that we work. But if you're passionate and you believe in something, you'll dedicate your time, and then you'll just push forward, and I think success comes. It's, as I say, don't wish for anything, don't hope for anything, develop a good plan, and then just start execution and hard work.
With the right people.
Yeah.
With the right people. And do you want to?
I think I'm 100% agree with Dero. I think our collaboration is very smooth. We understand each other. I mean, even I don't know. It's like very fast, very smooth. We don't have any. I mean, definitely we have very tough discussions because in order to, I mean, understand. Yesterday we had one of such kind of discussion where good challenge. We are challenging each other because you need to understand whether this idea is feasible, viable, or whatever. But I mean, overall, I think it's very friendly environment.
Yeah, the other rule that we follow quite a bit is we say, find the best you can. If you are going to do something, find the best you can. See if they'll share your vision. The moment they do, then you can develop a really nice team. And a team now that has the highest chance of success or opportunity for success. So that's one of the key things, and that's what we've tried to do. Is in everything that we try to do is like a puzzle, right? We try to find the best piece and the best folks and kind of combine that puzzle, and then make sure that it's serving a need and it has value. It's going to create value. Quite often people just are doing things and they don't understand what that value is. We won't do any development without understanding what that value is. So again, that the team is critical, and I would say it's the secret sauce in your success.
Thank you, both of you, for this talk. Thank you for watching, and continue to follow CivilNet.